students. Today I am going to go over the topics for exam number 4. You'll be taking exam number 4. A-Day students will take it tomorrow on Thursday, and B-Day students will take it on Friday. This will take the place of your final. Instead of having a comprehensive final exam, this is Unit 4 exam, which is over the knee, and it's also over foot, ankle, and lower leg anatomy and injuries. So those are the two sets of notes that you should have to study and review for this test. Just going to start. These are in random order since I'm just looking at a copy of the test, but I'll just go topically through these. All right, the first question is on the muscles of the around the knee. So we'll find that section. The question is, the hamstrings are the muscles that cause what at the knee joint? So the hamstrings, remember, hamstrings are on the back of the upper leg. So your hamstrings do knee flexion. Hamstrings do knee flexion. Your quadriceps on the front of the upper leg do knee extension, extending out. So hamstrings and quadriceps. The three main assessments for the ACL, for an ACL injury, and those are the Lachman. Let me find these so I can show you the pictures. The Lachman is where you take two hands and you're shifting, you're trying to pull the tibia anteriorly. This is with ACL is after meniscus. All right, here we go. So here's the three tests. This right here is the Lachman's, and you can see the athletic trainer or the doctor doing the Lachman test where they pull the anterior or pull the tibia anteriorly. It's a Lachman's test, and then the anterior drawer is right here, and the athletic trainer is going to pull the tibia forward here with the knee bent. So the three main tests for the assessment of ACL rupture are Lachman, anterior drawer, and then the third is on the next slide, I believe, and that is a pivot shift test. Next question, which of the following is not associated with a torn ACL? So some symptoms of a torn ACL would be they often hear a popping sound. Let's see if I can find. Let's go back. All right, so there's often a popping sound. There's going to be immediate swelling. There's a deep pain, just complete instability. I told you in class, I felt like I had like a Bambi leg. There's just no stability at all whenever I was trying to walk on that leg. Restricted range of motion. The knee will often be warm due to the swelling within that joint. The athlete will often take two hands, and I know this is exactly what I felt. I was looking down. I saw my knee shift side to side. So this is kind of the universal sign for ACL tear. The athlete will put their fists together and say it felt like this. So which of the following is something that's not associated with ACL tear on your test? A positive posterior drawer test. Remember, a posterior drawer test or SAG test, that's testing for a PCL injury. What is the main function of the meniscus in the knee? About meniscus, I believe that's right before the ACL here. All right. The meniscus, for your test, it's a shock absorber. Your menisci, your medial and lateral meniscus in your joint are shock absorbers. And it's a thick rubbery substance that really kind of takes a lot of that shock whenever we're pounding, where there's impact activity. The next question is, what are some reasons why females are more likely to tear their ACLs than males? And we don't believe that we know for sure why. I think there's a lot of theories, and we get to that here. Some of the theories are hormones at different times of the month. Ligaments may be more lax than other times. A wider Q angle, so wider hips, increasing the Q angle. A decreased intercondylar notch. I think I have a picture of that here. So the size of the intercondylar notch may be a reason. The strength of the hamstrings. Females may have a decreased hamstring strength, which we know the decreased hamstring strength puts more pressure on the ACL when you're decelerating. Biomechanics. Females may play their sport As athletes, they may not, when they land, they need to come down with bent knees and stay lower to the ground. So biomechanics may play a factor into that. Next question is about turf toe. So we'd have to go back here. I'm going to command find turf toe. Let's see where that's at. There we go. Turf toe. So your question is, turf toe can occur after forceful hyperextension of the big toe and or repetitive toeing off on a hard surface. We talked about turf toe, and we talked about, but the great toe is very important to balance and movement. Repeated hyperextension or toeing off, which is this picture here. This guy's toeing off. We talked about AstroTurf back in the, I don't know, I think it was created in the 60s and the 70s. They had in the Houston Astrodome, they had this AstroTurf, which was a very thin layer of kind of carpet that was laid down on concrete. So athletes were very fast because there was the force was not distributed. Now on turf, we have all of the tire particles, and it's a thicker surface. So you would not be quite as fast on that surface. However, this solid surface on concrete led to something called turf toe, which we don't see a lot of now. Next one, an arch sprain is caused by all the following except an arch sprain. Arch sprains are overuse injuries, can be due to fatigue. Someone being overweight could get an arch sprain, and then training on hard surfaces. So all of those things could lead to a sprain in the arch. Shin splints, which we call medial tibial stress syndrome, you all call shin splints. This can occur early in a training program if you're trying to do too much too soon, and that is that's your test question on shin splints. The highest of the foot arches and the most important one for impact absorption is and let's find the arches of the foot. Remember, we have three main arches that we talked about in class. We have the medial longitudinal, the lateral longitudinal, and the transverse arch. There we go. And the highest and the most important is the medial longitudinal arch. So it's the arch medial, let's get this on the screen, medial longitudinal, so the long, medial longitudinal. The lateral longitudinal is here on the outside, and the transverse runs across from side to side. Adductor strains are common among sprinters. Sprinters, typically they are going forward. So an adductor sprain, adductors are on the inside of the thigh. So that would be more of an athlete would be prone to an adductor sprain that is moving from side to side. So a sprinter probably most likely not to have an adductor sprain. More likely ham and quad. All right, here's an injury situation that's going to be on your test. A male basketball player came down on another player's foot, causing excessive inversion. What is inversion? We have inversion and we have eversion. Eversion is turning out. Inversion is in. So that's the most common ankle sprain that we've talked about. Okay, so a male basketball came down on another player's foot, causing excessive inversion of the left ankle. At the time of the injury, the athlete felt severe pain on the lateral aspect of the ankle. And so I want you to describe what you think has happened here, and that would be an ankle sprain. We could talk about grade 1, grade 2, and grade 3. If there's severe pain, it's probably above a grade 1. A grade 1 is going to be just mild stretching, sore, and probably play through that injury, but grade 2 would be severe pain. A positive anterior drawer test is a good sign of a PCL tear. Well, anterior drawer test the anterior cruciate ligament. So an anterior drawer test is not going to be a good test for a PCL tear. The posterior drawer or SAG test would be an example of a good test for a PCL tear. Who's at risk of tearing their ACLs? I'm going to go back to this slide. Who's at risk? Anyone that's playing a sport that requires changes in direction, accelerating, decelerating quickly. Increased risk would be fatigue. If you're tired late in the game, late in practice, after you've done a lot, the muscles are fatigued, the hamstring's tired. Increased posterior tibial slope, and women are at greater risk than men. So who's at risk? Really, anybody that plays sports is at risk of an ACL tear, though. Blisters. Blisters should always be broken to relieve the pressure on nearby nerves. That is going to be false on your test. Remember, we want to, as long as we can, leave the blister intact. And here's another injury situation. But ultimately, there's a little story here. But they're asking, what is O'Donoghue's terrible triad? So we need to know what the terrible triad is. Remember, we talked about the terrible triad being the first thing on injuries to the knee. That's going to be the MCL, medial collateral ligament, the torn meniscus, and the torn ACL. And I talked about in class, that's how my injury situation started, was with the terrible triad, the ACL, meniscus, and MCL. The symptoms are sharp pain in the back of the thigh, bruising, swelling, and loss of strength in the upper leg. What might this be? Okay, so let's think about back of the upper leg. What's in the back of the upper leg? Well, we have hamstrings there, and it says there's bruising, swelling, a loss of strength. So a hamstring strain, it could be a contusion, but most likely a strain of that muscle. Next one, there is a young girl, 12-year-old girl, complaining of pain on the tibial tubercle. Remember, the tibial tubercle is going to be right here, and there's a lump on this tibia tubercle, and she's going through a growth spurt. What might this issue be? We talked about, I know there's a picture here, we talked about with males, this is often the case. Get through the ACL. There's patellar tendon, patella stuff. I'm looking for my picture. There we go. Osgood Schlatter. Here's the tibial tubercle, but there's a lump on that tibial tubercle. It's when your bones are growing faster than your muscles and tendons can keep up. So there's a lot of strain, there's a lot of pull right here at this point, which is causing that bone to spur, to grow, and swell around that area. Also known as jumper's knee. We talked about this. It's a repetitive use injury, also known as jumper knee. And I think we're pretty close to it here. Maybe. There we go. Patellar tendonitis, also known as jumper knees. It's anterior knee pain below the patella, so it's pain right here. The grinding noise heard or sensed as one bone rubs against another. So it's a grinding noise. And we went over this in class just this week, or in the videos if you were watching this week. And that term, here we go. That term is crepitus. Crepitus describes it's a grinding, cracking, popping, creaking, any of the noisy joint symptoms that somebody may have. Your toes are your phalanges. That's a question on the test. Just a review from the anatomy from last unit. MCL stands for, what does MCL stand for? Let me grab my knee bottle. All right. Remember, here's the knee. Here's the fibula, so we know this is the outside, and we know that this is the middle. So the MCL, medial collateral ligament. We have the medial collateral ligament, the lateral collateral ligament, and inside the joint capsule, we have the ACL and the PCL. Swelling, swelling inside the joint capsule is called effusion. Swelling inside the joint capsule is called effusion. The heel bone, I don't have my foot model over here, but the heel bone is the calcaneus. The heel bone, I actually don't have a picture either. We can go back here. The heel bone is a calcaneus. I think we went through bones early. Right here is the calcaneus. Next question. The first step in taping an ankle. Ooh, actually, I know we didn't get to that this semester, so you will not have any questions on your test about taping, and I missed that one. But we would do skin prep. Heel pads would be the first step in taping an ankle if we had gotten to do that this semester. The patella rides in what? What is this right here, this little notch, if I can get on the screen, this notch right here that the patella rides in. We talked about how it's kind of like a slide, and as long as you're in the middle of the slide, it's real smooth and comfortable, and you can go down easily. But if the patella starts riding over on the side, or if you're on the side of a slide, it doesn't work as well. picture of that. Back with the anatomy of the knee. Well, I think we're getting close. All right, so right here, we have the trochlear groove. Oh, maybe we don't have it there. I thought we had the trochlear. Oh, there it is. Trochlear groove. Yeah, I was talking about right here. Next question is ACL stands for. What does ACL stand for? We have the PCL and the ACL. I think it's after meniscus. ACL stands for anterior cruciate ligament, ACL, and PCL stands for posterior cruciate ligament. And those are those two ligaments that inside the joint capsule here makes an X that cross each other. The inflammation of the fibrous tissue that runs from the hip of the outer side of the hip down to the outer side of the tibia. So this crosses the hip joint, and it also crosses the knee joint. So there could be pain at either the hip or the knee with this. It's a thick ligamentous band, but that is your IT band. Next one, which of the following is not a contributing factor into a muscle cramp? We talked about muscle cramps and how we've all had a muscle cramp from time to time. Fatigue can lead to muscle cramps. An electrolyte imbalance can lead to muscle cramps. Improperly fitting equipment, shoes, tight equipment can lead to muscle cramps. And excessive strain. Being dehydrated is another one. Compartment syndrome can include the following symptoms. Compartment syndrome, let's go back to our foot, ankle, and lower leg injury notes. And I'll find a picture of the 4 compartments. Maybe. There's Achilles tendon. Here we go. It's medial tibial stress syndrome. Here's compartment syndrome. So your question on the test, compartment syndrome can include the following symptoms. Swelling, yes. Early point tenderness and pain. Future inability to use the muscle. A developing of excessive nerve sensitivity, or all of the above. Your feet go numb with compartment syndrome, so it's not excessive sensitivity. So that one would be incorrect. When taping an ankle is important to start with, we'll not have that one on there. So there's 2. I'll add 2 new questions. Fracture of the fibula is easier to recognize than fracture of the tibia. So the tibia, it's the tough tibia, remember? The bigger one's the tough one. And then the frail, little, or the smaller one is the fibula. So they're saying it's easier to recognize a fracture of the fibula than the tibia, and that is incorrect. A tibia fracture is going to be much easier to recognize. You're not going to be walking very well. You may still be able to play a game. You're going to have pain with a fractured fibula. But the tibia is going to be, you're going to be worse off. A female track runner at the end of competitive season began to feel severe discomfort on the medial aspect of the right tibia. Okay, so this is a right tibia right here. So the medial aspect of the right tibia. And signs and symptoms. Complained that her shins ached all the time and the pain became more intense after practice or competition. During palpation, there was severe point tenderness approximately 2 inches along the medial aspect of the tibia. Patient was weak with ankle dorsiflexion. Remember, dorsiflexion is pulling the foot back. So this has a specific hot point that says exactly it's about 2 inches. So it tells you where it's at right here. If it hurts right here, that's more likely to be a stress fracture. If the athlete says, it hurts, there's pain all along the inside of the tibia there, that's more likely to be shin splints. Next one. A tendon in the back of the ankle or foot that attaches to the gastrocnemius and soleus. A tendon in the back of the ankle that attaches to the gastrocnemius and soleus. That is the Achilles tendon. I can find that Achilles tendon rupture slide here pretty quick. Achilles tendon. I thought I had Achilles tendonitis. It might just be the Achilles tendon rupture here. We can look at. There we go, Achilles tendonitis. So the Achilles tendon is right here, attaches into the soleus. Remember, it's deep, and the gastrocnemius is a little bit more superficial. But there's both the Achilles tendon. The P in price, P-R-I-C-E, so we talk about RICE a lot, rest, ice, compression, elevation. What does the P stand for? And that would be protect. So we want to, if we have an injury, you're going to be playing, we want to protect that injury if you're at practice, rest, ice, compression, and elevation. The large bony prominence is located on either side of the ankle. So on our ankle, I don't think I can get my ankle up here, maybe this one. My ankle, we have these two things that stick out, one on the inside and one on the outer side. This is my medial malleolus, and this is my lateral malleolus. A condition that develops when swelling exists in one or more of the four parts of the leg. So remember we talked about compartment being the four sections of the leg, and between the tibia and the fibula, there's no room for that swelling to go. Unlike if you were on get a quad contusion, there's space for the swelling to get larger there. A bony growth on the calcaneus is called what? So this would be the bottom of the calcaneus. A bony growth. An athlete may say it feels like they're stepping on glass or needles in the morning when they get out of bed. With this would be a red flag. I think this was one of our first ones that we did. There we go. A heel spur. I'm sorry, we're looking for plantar fasciitis. We're close. Plantar fasciitis right here. Here's the fascia on the plantar side of our foot. It's a wide, non-elastic ligamentous tissue that extends from the anterior portion of the calcaneus to the heads of the metatarsals down here. It can become strained from overuse. So the question that I'm reading here, a bony growth in the calcaneus, that would be a bone spur. And plantar fasciitis can lead to bone spur if they are not treated. True crescent-shaped wedges, the lateral and medial, aid in shock absorption of the knee, distributing the forces. So what are these two things right here? It's part of O'Donoghue's terrible triad. I talked about it extensively with different treatment options. Those are the menisci, medial and lateral meniscus.